harm you more than smoking. That feeling alone can increase your risk of depression, dementia, and even early death. And if the treatment is not a pill, what is it? It is people. So today we will talk about social connection, the forgotten medicine for our bodies and our minds. Loneliness is making us sick, and the social connection can save our health. So hello and welcome. I'm Dr. Joshua Dirito, a family physician, focused on public health and cancer prevention and treatment. Here, we turn complex science into simple science that you can use today. So let's look at today's topic, which is simple, powerful, and it is also life-saving. Social connection and your health. So what is social connection and why is it important? Social connections means feeling being seen, feeling being heard. It also means being valued and feeling belonging to others. It includes the family, the friends, it includes your marriage relationship and how good is the connection in your marriage. It includes also the church where you connect with other people and also the community, having workmates, and these being around people could either make you feel heard and appreciated, or can still make you feel lonely. So loneliness is not about numbers, but it is about meaning. The world statistics show that among the young people, 1 in 4 young people are lonely. And among the elderly people, these are people who are beyond 65 years, 1 in 3, one of them is lonely. And this is despite that we have had big advances in the electronic world. We think we are more connected, but then it is proving that electronics are more isolating us than getting us connected. There are more young people now who spend more time scrolling, and then they are more isolated. This is because the electronics, they are isolating us more than they are connecting us. You find that someone spends most of their time so much scrolling and not able to talk to anyone more than when we had no electronics. So that creates social isolation, and this creates loneliness. And we find that about 1 million people worldwide are suffering from loneliness on a daily basis. And the bad news, what does this social isolation mean? Social isolation means when you have few or no meaningful relationship. Then you feel disconnected, even when you are surrounded by people. You don't feel like there is any connection between the people whom you are with. Then you may also feel like there is no emotional support from the people whom you are with. I've heard of relationship, marriage relationship, whereby you have two people, they live in the same house, but they are more like roommates. Rarely do they talk, rarely do they share anything. They're just two roommates living together, and this can lead to social isolation. So loneliness becomes painful, and the body treats it like danger. So you feel like you are under threat. So what are the things that contribute to this big social isolation, to a point that some countries have created ministries to take care of loneliness? We have a country like Great Britain, they have a ministry of loneliness. We have a country like Japan, they have a ministry to take care of people who are living lonely. And then we also have a country like Korea, which is trying to subsidize finances to young people so that they can get back to connecting with others. And then in the US, uh, the Surgeon General report, who is like the chief medical officer, uh, uh, gave loneliness as one of the major disasters the countries are facing. It is even worse than the smoking pandemic. So what is causing this isolation? One is busy work schedules. People who have very tight work schedules, they don't have time to connect. So you are so fixed on the job, you are so focused on it that even when you are at work, the connection that you have with your workmates is minimal. Then you have phone addiction and social media overload. People who are always scrolling, they don't have time for physical, face-to-face connection. Then family conflicts. I've talked of marriages where there is disagreement between the couples. They're in the same house, but the communication between each other is minimal. This can cause isolation. Then we have divorce or loss of a loved one. Of course, divorce makes people depressed. It can lead to anxiety and even death. Any of those social calamities can lead to social isolation. Then moving to a new place. When you move to a new place, you are the new person, you do not know anyone, and then because of you being new to the place where you have moved to, this can lead to social isolation. Then chronic illness. People who have conditions like diabetes, hypertension, then you have heart diseases, or even stroke. So your capacity to move around is limited because of the illness, and this creates a social isolation. Then, of course, we have aging. Aging comes with joint problems. Also, the capacity to move around is affected. So it may make your interaction with others very difficult. And then depression and anxiety. Most of the mental problems can cause social isolation. You feel alone, you feel not connected. Then the fear of rejection, especially for people who have some emotional issues, that being outgoing makes them get social isolation. Then there is the personality disorders. They can also lead to social isolation. Then you have poor communication skills so that you feel you do not have the capacity to interact with new people. You do not have the capacity to start a dialogue with people. Remember that communication is a skill that you need to learn, either to listen or even to start and engage in conversations. So isolation does not just come at once. It starts slowly and quietly develops. So what are some of the risk factors that lead to social isolation? You are at higher risk of getting social isolation. One, if you live alone, you are the only one in your house. Then if you are elderly, you are likely to get social isolation. If you have chronic diseases like diabetes, cancer, or heart disease in its own can limit movement, and being limited in movement can make you to get isolated. Then if you are unemployed, of course, having a job makes you have people whom you meet on a daily basis, either to share ideas about work. But when you are not employed, you don't have a place where you can go and meet people. So you find yourself on your own. Then also if you are overworking, possibly your work is demanding. So it makes you have no time for social interactions. Then poor mental health, people who have depression, people may have anxiety disorders, personality disorders can lead to social isolation. Then if you have unresolved trauma, possibly as a child or in somewhere along your life, you have suffered some social trauma. Then, like for example, those who have been sexually abused or people who have suffered post-traumatic stressful disorder, they may find themselves having difficulties interacting with other people, and this can lead to social isolation. Then, if for any reason you have been involved in some antisocial behavior. This might put shame on you, and this might make you not be able to interact with other people. Then spending many hours online. People who are always scrolling, spending time with the online social connections, but in reality, they do not have real life connections. You do not have time where you have people whom you can sit, whom you can share. And like the time for holidays, this would have been a good time. One, to visit those who are not connected very much, like our parents, our elderly, and also those who may be suffering from the various conditions. And also this could be have been a time to break up from the social media connection when you're interacting with other people. It is good that you leave out electronics so that you can have real physical connections uh, with people in real life. It is always encouraged that more one-to-one encounters is better off than electronic connection. Of course, sometimes it's difficult that you'll be able to visit people physically, but just giving them a call, then that will prevent social isolation. So, what are some of the things or some of the ways that you may realize that you're having social isolation? There are the emotional signs, which include feeling empty, you don't feel fulfilled, feeling unloved, you feel others do not care about you, sadness, and you feel on your own, you do not have someone to share with, then hopelessness, because you think that people are not interested in you, you do not have someone to share with your life experiences. And of course, there is the sign of low self-worth. Then there could be some mental signs of social isolation. These include things like depression, anxiety, poor concentration, and then you have memory problems. When you have isolation, then your memory does not work to its optimum. And of course, there is a dementia risk. You tend to forget more because sometimes you may have uh, depression or even some anxiety, which makes your memory poor. So some of the physical signs that could suggest to you that you could be having social isolation include things like constant tiredness, you have poor sleep, and then you have body pains, which you cannot explain. You have a weaker immunity, and then frequent illness. So loneliness finds its way out through your body, through the physical symptoms that you present. Now, as I've said, social or isolation is associated with some of the major lifestyle diseases, and it is also associated with some mental problems. So, what are some of the diseases that social isolation is associated with? And people who have social isolation, they are at higher risk of suffering these conditions. One, we have the mental health risk. So, you find that people who have social isolation, they are more likely to suffer from depression. Then they are also likely to suffer from anxiety disorders. Thank you very much. Then people who have social isolation, they may find comfort from addictions. They may get addiction to things like drugs, alcohol, pornography, uh, addiction to electronic social media scrolling, and addiction to electronics. Then isolation can also lead to suicide risk. You find that before people commit suicide, then they become more isolated. They are lonely. They are on their own. They do not have people to share with. Then also, some of the mental risk include that people who have no social connection, they are likely to suffer from dementia more than the general population, and also cognitive decline, which is mental poor health. Now, this social isolation does not only affect your mental health, it also affects your physical health. There is adequate evidence that is showing that social isolation increases the risk of one, heart diseases. People who have social isolation, they are more likely to suffer from heart attacks and coronary artery diseases. Two, people who have social isolation, they are more likely to suffer from high blood pressure. Then people who have also social isolation are more likely to suffer from strokes. Then you have people who have social isolation are also more likely to suffer from diabetes. People who have social isolation, they are also more likely to suffer from obesity. People who have social isolation, they are likely to suffer from chronic inflammation. Why is this so? If you are lonely, then you have high levels of cortisol. Cortisol is a stress hormone, causes a cascade of events which increases your levels of insulin, your levels of uh, cortisol, your levels of the stress hormones. And so you find you have a likelihood of suffering chronic inflammation and more likely to have flare-ups of autoimmune diseases. Okay? Then cancer progression is likely to happen when you have social isolation. These are some of the risk factors for some of the lifestyle chronic diseases. Then, if you have social isolation, you are more likely to die early. Actually, it has been shown that people who have social isolation have their lifespan decreased by 2 to 5 years. So, having connections will make you live longer. So, this is very important that you have social connections. So, it is important that you develop your social connections if you want to live longer, because having no social connections decreases your lifespan. Okay, so why does social connection then decrease your lifespan? Research has shown that loneliness can be as dangerous as smoking 15 cigarettes a day. Think about that. So why does social connection uh, isolation, then how does it lead you to get more sick mentally and physically? When you are lonely, stress hormones go up. These are hormones like cortisol. These are hormones like insulin, and then also inflammation increases. Then also your immunity weakens, and then you also have a weakening of your sleep. Then your healing slows down. So connection calms the nervous system. Isolation keeps the body in a fight or a flight mode, and this makes you more sick. So how do you correct this social isolation? One, name it. You have to accept that when you are lonely, just say, I'm feeling lonely. Naming the pain is one way of starting the healing. Then reconnect slowly. There is what I call the 5-3-1 rule of social connection. On a daily basis, try to get in touch with 5 people. Then, on a daily basis, try to talk and build close connections with 3 people. And then try to spend 1 hour connecting with the people, either having group discussions, talking to people, and this will help. Some of the things that you can do to increase your social connection is call one person. It may not start dramatically, but if you consistently talk to one person, this will open up your doors. You have things that you can discuss together. Then you can also send a message, either WhatsApp or a message. Then share one meal. You can invite a friend to your house and just have a meal together, or you can visit a friend. These small steps matter a lot, and they could mean that your healing is starting. Then join a group. This could be a church group, could be a sports club, could be a person you invite, you work together. You can play table games with a friend, and then you can also join a support group. People who have common ambitions and common things that you want to do. Then you can learn a skill, and then this learning will take you to a class or a group where you can learn together, and this starts the journey of belonging. Then also be present when you are with your friends. Be there. Put down the phone. Have a one-to-one discussion. Always, physical connection is better than electronic connection. Look at people in the eye. Learn some communication skills like listening, initiating a discussion. Try to initiate discussions with people whom you don't know, and this will increase your confidence of getting to know people. Then also listen deeply. The easiest way to get a discussion with people whom you don't know, let them tell you about themselves. You will never go wrong on this. When you ask someone about himself, they will talk to the head of the world, telling you what are their hobbies, what they like. And when you want to meet someone whom you don't know, or someone whom you think you need to have a connection, have some idea of what they like. And then you can start a discussion on what they like. And you talk endlessly. And then learn the uh, communication skills. Some of the things that help maintain is one, maintaining eye contact, having a firm handshake, then asking people about themselves, then listening and asking open-ended questions like, tell me how you spent your holiday. Someone will tell you what they did. Whom did you meet during the holidays? They'll tell you about the people they meet, what activities they engaged in, what was interesting, what was not. So learning to ask open-ended questions, and that will give people an opportunity to talk about themselves. Then quality, remember, quality beats quantity. You may spend 10 minutes with somebody, and that might look like 10 or like an hour or a day because of the way you listen to them, the way you make them feel valuable. So when you have a meeting with somebody, do not scroll. Do not keep your eyes on your phone. I find this habit. People have come for a meeting, possibly they are meeting for a drink, and each of them is on his or her phone. That is not social connection. You are apart, but connected to your gadgets, which kills communication. Then, if you feel that you are feeling lonely, you do not know where to start, then seek help. If loneliness, you feel you're depressed or you're getting anxious, talk to your healthcare provider, talk to your counselor, talk to a trusted leader or a friend, and share with them how you are feeling. Help is strength. It is not weakness. The truth is, you do not heal alone. You are wired for connection, and this is how God created us. We are not meant to be on our own. So your body heals better, and your heart feels safe when you are connected with others. So social connection is medicine. It doesn't cost much, but it calls for awareness, and then the willingness to take the next step to connect with others. And then always reach out to others when you feel you need help. So if this message has touched you, like this video, and then also share it with others. And also for more health tips on how to manage your health, subscribe to the Overall Health YouTube channel so that when I release any new content, you are notified. And always, we meet on Sundays at this time, 8:30 p.m. Next Sunday, we'll be talking about some of the healthy risking behaviors that we engage in. So do not be left outside. Let's meet then. And also remember that if you have issues connecting, we have the Health Insight 360 coaching program. This is a one-on-one coaching program or group coaching, which will give you more insights on how to cope up with these lifestyle diseases, and also to eliminate the risk of getting lifestyle diseases from your life. And then share this with someone who needs to hear it today. So together we'll heal as a people. Thank you for being here, and remember that connection saves life. See you in the next session. Share the Overall Health YouTube channel at Dr. Derito. Thank you for joining.